Join Marty Johnson, the holistic health practitioner and founder of Total Health Nutrition Center in Menominee Falls, Wisconsin, as he delivers these podcasts to enlighten you and give you hope that there are health solutions to conditions that seem difficult to resolve, or even better answers than a medical approach of prescribing a chemical drug, which most times is nothing more than a Band-Aid fix, rather than getting to the root cause of your problem. The mission of the Total Health podcast is to provide the education and support that will lead to transforming people's healths so they can live a much more efficient, productive, and happier life the way God intended it to be. Join him now for his latest podcast.
All right, this is Marty Johnson here. We're here with another podcast, and we have a special guest here, Janell Strupp. She's going to be talking about Fascial Counterstrain, and she's a physical therapist. Welcome, Janell.
Thank you, Marty.
Yeah, so I'd like to just maybe ask her a few questions so that we can get a better understanding of this phenomenal approach to actually helping structural issues. You've heard me talking about different things about holistic medicine and how we like to get to the root of the cause of issues, internal issues that could be causing symptoms. Well, this is a technique that can actually get to the root cause of structural issues that are really, really difficult to manage sometimes and actually handle. So, Janell, I'd like to just, the audience maybe kind of get a little bit better idea of about you and your family and your background and things like that.
Okay, thanks, Marty. Well, I've been a physical therapist for over 25 years. I graduated from Marquette University in 1993. And I have been focusing my area of expertise on fascial counterstrain ever since my oldest daughter suffered a concussion 7 years ago. Her brain trauma was not healing despite receiving conventional medical treatments, and as her mother, I was driven to search for the solution, which turned out to be fascial counterstrain. My daughter experienced immediate life-altering results with the treatments.
That must have been kind of a scary thing with, going through all that, huh?
Yes, it was. We just didn't know where to turn. There weren't answers in place for us.
Yeah. So this actually started to pull her out of some of the symptoms she was having. And
she had immediate changes. She sat up from her session and said, "My head feels lighter and I can think."
Ah, that's awesome.
She was able to start driving again and participating in activities as a student.
Cool. Good. Yeah, so this technique is what Janell's going to share with us today, and right off the bat, you can see how it created life-altering results in her daughter. So Janell, why does this counterstrain technique work exceptionally well with holistic medicine, as far as in concordance with that? Why does that work so well?
Well, after experiencing firsthand on myself and with my family members what it's like to go through with pain, trauma, and injury, I really feel that it's important to integrate a holistic healing approach. Now, the fascia needs to relax so that it's not in a state of spasm, which opens up the blood flow, and that means it helps your body to utilize the nutrition that you're getting or not getting. And if a person isn't getting a satisfactory amount of nutrition, their body eventually will send out a distress signal. As toxins accumulate in the body, once someone reaches their individual threshold of tolerance, the body will start to produce a symptom.
Yeah, we call that, like, you've heard me on other podcasts, we talk about, the bucket tipping. So when the body gets exposed to too much of a stressor, whether it's toxicity or even injury, things start to tip and the body doesn't respond like it should. Is that kind of what you're referring to?
Yes, that's what I'm referring to.
Yeah.
So often people go to conventional medicine, which masks the symptoms and doesn't actually correct the true source of the dysfunction. And this can lead to progressive problems and unwanted side effects. But when you put in the time and effort to analyze and detect the true source, or even the multi-system sources from many areas in the body which accumulate in complex chronic pain or dysfunction, and you learn to listen to and follow the body's cues as they are given, not just what's convenient in your busy day, and really listen to the dictator and respect what your body is telling you. Oftentimes that will provide the clarity needed to heal yourself naturally from complex physical, emotional, and environmental triggers.
Okay. So is it safe to say that it sounds like this technique is a gentle technique where you're actually listening to the response of how the body's nervous system is responding to some of the things that you're wanting to treat? Is that
That's
correct?
right, Marty.
Yeah. Okay.
Yes. Fascial counterstrain is a highly skilled method that relies on a cranial scan. So I feel the top of a person's head to scan for all of the body's systems to locate and treat the origin of the pain.
Okay. So what are you actually feeling? Are you feeling like pulses, in a sense, of different cranial fluid movements, or how does that work?
It's a little different than that.
Okay.
So that approach might be more like craniosacral therapy, which is another technique that I can use.
Sure.
But in fascial counterstrain, we are feeling specific rows of tension and spasm.
Ah, okay.
So our body's fascia is a huge sensory blanket that covers every system. It's made of connective tissue, and it covers everything inside your body. For years, researchers simply thought that fascia was a coating and structure, and now we're finding out that there's a lot more to it than that.
So it's like a whole sensory system in a sense, is that right?
Yes.
Okay, interesting.
Because fascia is so highly sensitive, its role is to receive sensory input from mechanical, chemical, or thermal mechanisms.
Wow.
And these could include postural strain, inflammatory disease states, physical trauma, surgeries, or dietary inflammation.
Okay. Yeah, so that would explain that, it's more than just, I injured myself, but there's other internal things that we could be doing to our bodies, how you eat, what you're exposed to, what kind of products you use that can create problems for that fascia and the whole structure, huh?
Correct.
Okay.
Yes.
Interesting. Is there more advanced forms of this counterstrain, or is it all the same, or is there different levels of it?
There are differences in counterstrain. Originally, it was developed by an osteopath named Lawrence Jones, and he had about 200 points that he found in the body that he could relieve by positional release.
Okay.
But he didn't know why it worked. And he passed away in the 90s and left this technique to a man named Brian Tuckey. And there were several physical therapists who continued his work, but Brian Tuckey has gone on to develop over 4,000 points, and combining this with the latest scientific research on fascia, he has determined why it works, and it's become so much more effective.
So it's become more scientifically proven and validated, it sounds like.
Yeah, which is a good thing.
Yeah, yeah. So Janell, you're a physical therapist. You have years of training in that area as a physical therapist. Obviously, 25 years. It's amazing. This technique sounds like it's above and beyond the average physical therapist as far as what they might do. Is that correct, or am I reading that wrong?
I would consider it a specialty.
Yeah.
It's not taught in most schools.
Sure.
Not yet, anyway.
Right. So, which is awesome. I mean, having someone with your caliber of knowledge in the body, and then having these other techniques that can get to the root cause of some of these physical things is really cool. So how exactly, you mentioned some of the things of what it's doing, but is there anything else you can add as far as how exactly it works, with helping people and stuff?
So with fascial counterstrain, the already short, tight muscles are placed further into a shortened, relaxed position. It's the position of ease and comfort. Mm-hmm. So you can imagine how gentle that would feel.
Sure.
And by placing the faulty anatomy, whatever system we may be working on, placing that on slack, this optimally shortened position removes the internal stressors and it deactivates the pain receptors. Just by holding the tissues in that particular position, local inflammation will decrease and noxious chemicals can be carried away. So counterstrain will embrace the concepts of holistic and osteopathic medicine in that it addresses the body as a whole, normalizing blood flow, muscular tension, vascular drainage, nerve input. Counterstrain can really maximize the body's intrinsic healing capacity.
That's great. Yeah, we talk a lot about, the body, has the innate ability to heal itself, and this technique is really kind of unleashing that, and letting the body heal better. And that's really what we talk about a lot in holistic medicine when we're working with people, is if we can get away the interference, the body can heal, right?
Yeah.
It's really cool. So, really to wrap things up, I'd like to just kind of know, what would, if I were a counterstrain client, fascial counterstrain client, what effects would I expect to see with treatment, by doing this technique?
Sure. Typically, the clinically observable effects that I look for would be an automatic decrease in pain, decrease in tenderness at the site we're working on, decreased swelling, normalization of muscle tone, improvement in circulation, improved posture, improved proprioception, which is the sense of where you are in space in your joints, improved efficiency with recruiting muscles, improved range of motion, strength, and functional performance. So it's really a blessing. I am grateful to be able to share this work.
Yeah, I love it. There's so many benefits of this technique, and yet it sounds like it's quite relaxing and comfortable to have it done. You're not digging in and creating a ton of pain while you're making these corrections. Or can you say anything to that? Is it pretty relaxing for people? Or
yes, people do typically report an improvement in their sense of lightness as they're leaving, their range of motion. Say someone came in with a tight neck and couldn't check their blind spot while they were driving. Usually that'll improve, even in some of the most tough cases.
Cool. Is there anyone off the top of your head, that you can think of that, a particular client, obviously we're not mentioning any names, but just, you mentioned your daughter. Can you give us just a real quick synopsis of someone that overcame something that was chronic that they thought they would never overcome?
Sure. I've worked with a woman who was told that she had arthritis in her hip, and she had seen a chiropractor for a year. That arthritis wasn't going away, and she saw an orthopedic surgeon and was told that she needed surgery right away for a hip replacement. This woman came in and was seen by myself, and the first session she sat up and she said, "Where's my pain? I don't feel it anymore."
Wow.
She walked out with much greater ease, and it's 2 years after the flare-up of pain, and she is not in line for a hip replacement anymore.
That's phenomenal. So that's a great example of getting to the root cause of, obviously, that was being missed with some of these other techniques. Not that chiropractic's bad, but in this particular case, there was a root cause that was missed, and this technique was able to find, help with that. Yeah.
Instead of going in and cutting out the problem, we actually help the body to heal it.
Right. It actually, the innate ability to heal itself. Great.
Yeah.
Awesome. Well, thank you so much for sharing with us. And so kind of wraps up another episode of our podcast. And we thank you so much for being with us.
Thanks for joining us today on the Total Health Podcast. If you'd like more information about how Total Health can transform your health, check them out. They would love to set up a free consultation with you over the phone. Call them at 262-251-2929 to make that appointment. Otherwise, you can check them out on the web at www.totalhealthinc.com.